Hi, I'm Liliana, and I decided to do my climate change and health PowerPoint over air pollution. I'll go over my slides following with the introduction first, evidence review, nursing and healthcare perspective, action plan, and then the conclusion. According to the World Health Organization, air pollution is defined as contamination of the indoor or outdoor environment by any chemical, physical, or biological agent that modifies the natural characteristics of the atmosphere. So some common sources are your vehicles, industrial buildings, fires, household combustion devices. Um, so some ways to like reduce these ambient air pollutions could be policies and investments that support sustainable land use, cleaner household energy and transport, energy efficient housing, power generation industry, and better local waste management. Um, and you can see on this slide, I used a graph that measures PM 2.5 air quality, and PM 2.5 is inhalable particles that are really fine with the diameter that's 2.5 micrometers and smaller. Okay, and for my evidence review, as you breathe in excessive amounts of PM 2.5, it can lead to heart disease, asthma, um, low birth weight, not to mention reducing visibility, causing air to appear hazy. So your heavy metals like lead and cadmium are found in cigarette smoking, causing emphysema and COPD in generations that are exposed to it. And this study also found that smokers have a 30% lower lung capacity than those who don't smoke. So your exposures to nitrogen dioxide, tobacco smoke, and particle matter negatively impact the fetus. Um, they also disrupt placental hemodynamics, reducing that oxygen supply. So, with my bullet that talks about cancer, it actually found that lung cancer increased in groups exposed to combustion products of fossil fuels. Nursing and healthcare perspective. So, with air pollution significantly impacting the cardiovascular and respiratory systems, this increases the amount of hospital visits, uh, and this impact on patient health and safety needs to be considered regarding the conditions that um, this affects in your marginalized communities. So, nurses need to be educated on patients and their environmental triggers, advocating for those vulnerable populations, and influence institutional policies towards sustainability. So, this graph is your typical air quality index that you'll see in states like New York, and it is typically issued the day before or the day of for a region of that state, and it reflects how affected it is by poor air pollutants. So it can be found in broadcasts or news stations, and it's a good indicator to know when to stay indoors. And for your action plan, um, or the action plan, um, at the individual and community level, you'll want to just educate your patients on air quality risks, supporting those vulnerable populations, um, and then with those vulnerable populations, just making sure that transportation is more accessible, heat saving strategies, and then um, creating public awareness for those air quality indexes. And then at the organizational level, you want to implement sustainable healthcare practices, developing resilience plans, improvement for those facility ventilations, so preventing or reducing triggers. And then policy level, strengthening air quality standards, phase out fossil fuels subsidies, redesign urban areas for less traffic, and then establish low emission parameters, and so on, and so much more. So to conclude everything that's been stated, nurses are critical in addressing the threats of climate change and its impact on public health by educating and advocating for fostering sustainable healthcare. Um, Nurses communicate the health risk of pollution, so these respiratory and cardiovascular effects. Nurses can provide teaching on the air quality index, so whether that being closing the windows during busy traffic hours, air cleaners, N95 masks when appropriate, energy saving transportation methods, um, and then nurses can educate on how to reduce exposure to pollutants. And then nurses can advocate for vulnerable populations and communities. And then these are my references.